Hello and welcome to Healthy Living. I'm Dr. Donald Pelto, and I have Bree Wright here with me, and she is a registered nurse in Canada, and she does a lot of work with nail care for the diabetics and for others that need this type of work. So, Bree, welcome to the show.
Thank you for having me.
You're welcome. So, tell me a little bit about your history in terms of nail care and exactly how it is in Canada, because it's a little bit different than here in the States.
It is a little bit different. So in Canada, we have quite a few foot care nurses. I know in the US, you have quite a few more podiatrists. At least in the province that I'm from, we probably, foot care nurses outnumber podiatrists 10 to 1. So it's really a required service we see. I do nursing foot care full time.
Mm-hmm. And
Mm-hmm.
is it all for diabetics, or is that the majority, or is it cosmetic, or is it both?
No, it's not cosmetic at all. It's medical foot care. There's a three-tiered system in Canada. We have our podiatrists, then we have our foot care nurses with their scope of practice, and then anything that's not medical, that's more aesthetic, that's what the estheticians and pedicurists take care of.
Okay,
So
so it's kind of
we try
Mhm.
and work as a team. You find a qualified, podiatrist, foot care nurse, and pedicurist, and we each have a role.
So these are for more high risk patients, those that could have problems.
Right. Yes.
Okay, and there's this new technology that we're going to be talking about that's kind of new to us in the United States, and maybe new to you in Canada, and maybe new to the world. So how did you come about hearing about this, and what has it been like?
Well, it's actually been absolutely fantastic. Onyfix, it's a nail correction system. It's meant for ingrown toenails. I'll discuss it in a little while, but we launched in Canada. It's been in Germany for quite some time and used across Europe, but launched in Canada last September and just launched in the US. So I'm excited for you and all of your patients. You'll get the benefits of it. I actually came across it. I'm a registered nurse. I've been practicing nursing foot care for just about 20 years. I'm a lead instructor for several nursing advanced foot care programs, and I'm also a provincial advisor for the Canadian Association of Foot Care Nurses. So I do quite frequently get asked what I think about new products, and it takes a lot to impress me. I'm telling you, this product has changed my practice. I'm so excited about it. I'm so passionate about it. It has helped so many of my patients that have ingrown toenails or pain from involuted nails.
Yeah, and we talked about you've done probably about 100 patients last time we chatted, something like
It's
that.
probably closer to 125 now.
Okay, so
The
that's
more that
probably
people, the more that the knowledge of the product gets out there, the more people are saying, wow, this sounds like something I want to try. And when they try it, they love it. Word of mouth just is the best form of advertising when someone is so happy with the results of a product like this.
Yeah, and in terms of you talk about this system, you have the podiatrist, then the foot care nurse, and then maybe someone that does pedicures that's
Mhm.
non-medical. Where does this fall in terms of the scope of care? Before we kind of get into talk a little bit more about it, do podiatrists send them to you? Do you refer them back to podiatrists? Because I know what kind of in the States, what we can do basically is numb the toe up and take out a portion, or we can numb it up, take out a portion, and put a chemical in to kill the root. That's basically the two
Right.
options I have for ingrown toenails now.
Right. And so as a foot care nurse, I wouldn't be doing something like that. Somebody who requires that being done, I would have to refer on to a podiatrist. That being
Mhm.
said, there are a lot of patients that really can benefit that up to this point, that's been the only option to relieve the pain from the ingrown toenail or from just the involuted nail, the pressure that it's causing. The Onyfix actually can be used by both foot care nurses and podiatrists,
Yeah.
and it's fantastic. In fact, our local surgeon that does a lot of our matrixectomies wants everybody to try this as a non-surgical procedure first before we
Wow.
move forward. There are some people that will need the surgery, but a great portion of people are finding they don't actually need the surgery. The Onyfix corrects that involuted nail.
That's great. Now everyone's really
Yeah.
excited. So now I'm going to have you kind of start and show. You have a couple of slides that you can kind of walk us through it, if you wouldn't mind just showing
Sure.
your background here.
Onyfix, this is a brand new revolutionary nail correction system. We don't call this a bracing system. It's a nail correction system. It is absolutely pain-free, non-surgical, non-invasive. It's an evidence-based medical device that is suitable for even the most high-risk patients. And in fact, in Canada at this point, it is considered a Class 1 medical device. You do need training and certification in order to properly use and apply the product, but it's absolutely stunning what it can do. So just a little bit of background. We all know that involuted nails, or nails that curve like this, cause pain, inflammation, and put our patients at risk for infection. And so people ask, what is the theory behind Onyfix? And really, it's so simple. I don't know how we didn't come up with this sooner. Most nails grow straight at the matrix, and the matrix is where the nail cells are created, right at the base of the nail. They tend to curl once they reach the nail bed because the nail bed, the skin, is just too small for the amount of nail that's trying to fit. And so what the nail does is it takes the path of least resistance and ends up curling. And that's what causes those painful involuted nails.
Mm-hmm.
When you apply the Onyfix is actually like a little piece of, it's a resin that we put on and we harden with a special light at the base of the nail. So as the nail grows out, it actually hardens into a concrete-like material in a strip, and it provides enough support that the path of least resistance is no longer to curl in the nail bed, but rather to keep that same straight shape that it was naturally created to have.
Wow. And then as you put it on there, you have to, they come back, let's say every 9 weeks or every, I don't know, what is coverage in Canada? Is it here? It's every 61 days. I don't know what it is there.
Onyfix right now isn't covered, and in fact, we don't have coverage, at least in the province that I am from, for podiatry services at all. We won't go there.
Okay.
It's a
Wow. Okay.
travesty. Everything is private here. So
Okay.
it
So,
depends. That's something that the practitioner and the patient, we sort of discuss what is the best amount of time to keep coming back and reassess. Depends on the state of involution, amount of pain, and really to cost, if the patient can get to the clinic. Some patients have, reduced mobility or the ability to get into the clinic.
okay. So basically they would come in, and since it's going to correct it, it's going to take a couple of visits of reapplying it. Do you take that old one off then and put a new one on as it grows out, or do you leave two of
No,
them
in
on?
fact, that's perfect. You just led into my next slide perfectly. So these time frames are very, very vague that you see, but you see the dark blue strip at the base of the nail there. That represents the Onyfix strip. And so it just stays on the nail for the entire length of the nail to grow out. And so the Onyfix tends to stay on. It can be different time frames. If you have a young, healthy nail versus an older nail, that has maybe some vascular issues and isn't growing as quickly, it will stay on until it reaches about the distal third, so the last third portion of the nail. Then there tends to be more flap to the nail and the Onyfix falls off. At that point, they come back and we put on another strip. Now, how many strips you need to fix the involution or the curvature is really patient dependent. It can take one. I've seen it, fix some involution, minor involutions with one strip. It can take 3 or 4. It's really patient dependent.
So Bree, as we look into this, it looks like this is how it's fixing the nail over a period of 36 weeks. And so how many applications would this type of a patient need, do you think?
Well, it does depend on the patient. I'm finding with my younger patients that don't have any other issues, I'm finding I'm replacing the strips probably about the 4-month mark. It's coming off about the 16-week mark because the nail just grows so fast. Also, these patients tend to be a little bit more active, and even the rubbing in the shoe. If you have a thicker nail, it tends to adhere better. And typically older patients, the older we get, the nail tends to thicken a little bit. And those younger nails, if you picture building a concrete wall on a sandy base, it's the thinner the nail is, the more that it moves, the less likely it is to stay on for that greater amount of time. So it's really dependent on the patient. I've had it stay on some patients for 9 months, but those are older nails, thicker nails. They don't grow as quickly. So there's a couple of issues that you have to take into consideration. But even my youngest patients, they typically last at least 3 months. I like to see my patients because Onyfix still, it's only been in Canada for a year. I still like to stay right on top and watch as we're going along and get patient feedback. So whenever a patient gets Onyfix done, I like them to come back monthly if they can and get feedback and take a look at what's happening. So that's what I'm finding. Between the 3 and 4 month mark, they're getting it replaced.
One of the concerns I had is at the base of the nail where it grows from. If it's quite curved, it's still going to uncurve it a little bit, right?
Yes.
Okay.
So Onyfix it's not necessarily going to work for everybody. If you just have, it's physiology. If you just have too much nail that it won't fit in the nail bed, they're going to need a matrixectomy, a surgical procedure that you talked about. If the issue is that it's a little bit of a space issue and the involution of the nail bed is for some reason, it could be trauma, could be genetics, could be many different things. But if the nail bed is just too small, as long as the nail, when not curved, can fit in the nail bed, the Onyfix will do its job.
Wow, that's
Yeah.
impressive right there.
So there's
You
two
have more?
types of Onyfix too. I've got a
Yeah.
picture. There's Onyfix hard, which is the last two pictures that you've seen, and Onyfix soft. And if you take the training, we'll explain the difference between the two. But basically, the Onyfix hard is typically used on the bigger nails, and the Onyfix soft, which we'll get to right away. I'll just let you look at that picture there.
Wow, look at how
Quite
it
a
straightens it
significant.
out. Yeah, those are
Mhm.
the, I've done a couple of them up till now, and those are it's been the bigger ones, the harder surfaced ones.
Right. And so this is a picture. Oh, where did we go? Oh, perhaps in the interest of time, perhaps I didn't put a picture of the soft, but basically the soft is the same as the hard. It's just easier for practitioners to use on the smaller nails. So
Yeah.
the Onyfix is like a resin that you have to work, but you have to be very careful to not touch the skin when you're using this.
Okay.
If you touch the skin, any oils can affect the compound so that it doesn't harden properly, or so that it doesn't adhere as it should. So the Onyfix soft is just a different consistency for practitioners to use on the smaller nails. It is exactly the same product, but it's really nice for people who are applying it to know that they have options. Let's say if one nail happens to be too small, to really work that Onyfix hard in.
Wow, that's neat. So, I can see the difference it's really made. This is in the last, you've been practicing 20 years, so this has been kind of a practice changer. There hasn't been really big
Complete.
things like this that's happened, right?
No, this is absolutely revolutionary. This is fantastic. I have so many patients, and the biggest thing that my patients are saying to me is that the biggest impact that it has on them is the reduction in pain. They are so uncomfortable. They're not necessarily always growing in. Sometimes it's just an issue of being so curved and involuted that it causes them constant pressure and discomfort. After
Yeah.
even 1 month, my patients who are normally chomping at the bit to get in and have me reduce that nail so there's not so much pressure, I'm calling them to remind them of their appointment, and oh, right, I forgot about that. Where normally they know several days before because they're starting to feel that pain again. Where I notice as a practitioner, it's huge, the difference at 2 months. I've had patients whose nails are so involuted, but they don't want to have, let's say, a matrixectomy done because they're, concerned about the surgery or whatnot. Come at the 2 month mark, I can feel the difference. You can see the difference when you get in there with your instruments. As a podiatrist who's worked for quite some time, sometimes we know our patients' feet better than their faces, even when they're long-term
Yeah.
patients. And it is so profound. And this isn't just a one-time deal. This is what I'm noticing consistently across the board. Yeah, the reduction in pain is phenomenal.
Now, one thing that we typically see, I think you're referring to, is I kind of equate it to like the gutter, where the nail runs in the gutter, and that gets the buildup. I kind of equate it to the leaves building up, like the callus builds up. So you probably notice less of that callus in the nail edge.
Much less. And in fact, clinical studies actually show that the Onyfix helps repair the damage that's done. And the nail bed actually doesn't become so deep. It actually levels out.
Yeah, that's what the pictures seem to show. You can kind of see it how it flattens out. It's pretty amazing. And so if you have patients, I know you've been doing quite a few of them. So once they're done, they've done maybe their 3 treatments, or it's been 9, because it takes 9 months to a year for a new nail to grow out. Are you a year out on any of your patients quite yet?
We are just on the cusp. So we launched in September and we're at the beginning of August. So we're very close, but I'm seeing great results.
That's great. And then that's it. You do maybe the 2 or 3 applications, and then you're done and they're happy, and you just keep seeing them for regular care.
Regular foot care, yes. A lot of people sometimes ask, once you fix the curvature or the involution, will it occur again? And obviously, we haven't in Canada done it enough to know that, ourselves. But what it comes initially from Germany, and what they found in studies over the last 3 years, that unless there's a biomechanical issue, or unless people are doing things to make that nail curve, such as wearing very tight-fitting shoes, something that sort of squishes the nail together like that, it's not reoccurring. So that's really encouraging to hear that that's what their results are.
So Bree, for those that are interested, they've watched this, they've seen how the ingrown toenails can be corrected. And if they want to find a provider here in the United States or in another country, where can they go to get more information about this?
Well, you can access videos. Neuberg has put on videos about Onyfix and the procedure information on YouTube. I do know that coming down the pipeline for the US and Canada, they are putting together a provider list. Because we're so new, we just launched in the United States. It's not available quite yet, but it is coming very shortly. So people will be able to look that up online and find a provider in their area.
Very good. Very good. Well, this is Bree Wright. She is a registered nurse and she does podiatric nursing care or diabetic nursing care. So thank you so much for being on the show.
Thank you for having me.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.